The second part, we will talk about the clinical common. The second part, we will talk about the clinical commonality in immunology. Antibody complement, lymphocyte can all participate the immunity, but they participate in different ways. Antibody and complement participate in humoral immunity. Lymphocyte participate the cell immunity. Lymphocyte system consists of T lymphocyte and B lymphocyte. T lymphocyte's function is to regulate or eliminate antigen, but B lymphocyte is activated by antigen, and the B lymphocyte can be changed into the plasma cells, which can produce the antibody. Immunoglobulin represent a heterogeneous group of protein with antibody function, which cost of two basic donate to heavy chains to large chains. Between heavy chains and light chains are bounded by the disulfide bridge. There are 5 classes of immunoglobulin: IgG, IgE, IgD, IgA, IgM. Every class of immunoglobulin has its special function. IgG represents previous infection. However, IgM represents recent infection. IgA is an antibody that plays a critical role in mucosal immunity, which can be used as the first line of our defense. IgE usually mediates hypersensitive reaction or parasite immunity. Immunoglobulin increasing can be caused by less synthesis. For example, the immunosuppressive therapy after transplantation. The immunoglobulin decreasing can also be seen by the genetic disorders. For example, the severe combined immunodeficiency. It is the genetic disorder of immune system. The other disease of the inherited IgA deficiency can also decrease the immunoglobulin, especially AIDS. The HIV infection can cause the AIDS, and the AIDS immunoglobulin, the patient of AIDS, the immunoglobulin decrease too. Immunoglobulin increase can be seen in the polyclonal or monoclonal gamma-prime complement system. The complement system consists of more than 30 plasma protein as well as receptor on blood cells. The complement can initiate inflammation, and eliminate the antigen, and also activate mast cells to release histamine and other factors. Complement activation has the 3 pathways: classical pathway, alternative pathway, and the MBL pathway. The initial activation of the 3 pathways is different, but at last, the complement activation can make cells broke or die. C3 and C4 are the most frequently detected complement. Now we can use the immunotarget method to detect the C3 and C4. The complement system increase because the C3 and C4 are acute phase reactant, which increase in some system infectory disease, or some acute inflammation. Sometimes, in physiological conditions, for example pregnancy, the C3 and C4 will increase too. The complement system decrease because the immunocomplex are present, which can activate the complement to consume. So the complement decrease is a very important indicator for the presence of immunocomplex disease or for the activity of the disease. For example, the SLE and RA, etc., just like this autoimmune disease. T lymphocyte surface markers. Each group of lymphocyte, according to the different CD molecules, the lymphocyte can be separated into the different lymphocyte: the B lymphocyte, Th lymphocyte, Tc lymphocyte, and Ts lymphocyte. Different CD molecular on the surface of T lymphocyte are the markers that can be detected by some method. The CD3 is the markers for all of the T lymphocyte. CD4 is only the markers for Th lymphocyte. The CD8 is the markers for Tc and Ts lymphocyte. B lymphocyte's marker is the CD19, CD20, and 22. Now we can calculate the percentage of positive cells by flow cytometry. By using the monoclonal antibody against the T lymphocyte surface markers, we can get the percentage of the T lymphocyte or B lymphocyte percentage. This is the reference range of CD3, CD4, CD8, and the ratio of CD4 and CD8. CD3 increase can also be seen in some the immunoactivations, which can also be seen in reaction of post-transplantation. The decrease of CD4 lymphocyte means the immunodeficiency. The AIDS is the common disease. We can see the CD3 T lymphocyte decrease. The CD4 decrease because some virus infection, the virus can attack the CD4 T lymphocyte, for example, the HIV virus. And so when the patient just suffered virus infection, the CD4 T lymphocyte will decrease, especially the HIV infection caused AIDS. But in autoimmune diseases, the CD4 T lymphocyte will increase. CD8 is opposite to CD4. When autoimmune disease, the CD8 T lymphocyte decrease. But virus infection, the CD8 lymphocyte will increase. So we need also to pay attention to the CD4 and CD8 ratio. Especially in AIDS, the CD4 and the CD8 ratio can also be seen less than the 1.5. The CD4 and CD8 ratio can also be seen in the autoimmune disease. This picture, I will provide some questions of this class. After class, you can review this class by some questions in this part. Thank you for your attention.